If you or someone you care about has been living with depression, OCD, or nicotine dependence, you may already know that therapy and medications are usually the first steps. But for some people, even after doing everything right, the therapy, the medications, the effort, things don't shift. And that can feel deeply frustrating. There's a reason for that, and there's something we can do about it. In conditions like treatment-resistant depression, or OCD, or nicotine dependence, certain regions of the brain involved in mood, motivation, and thought regulation can become less responsive to traditional treatments. The usual chemical signals don't work the way they should. Neural pathways struggle to reset. In these cases, your brain may need a different kind of support, one that works directly on those circuits. Deep Transcranial Magnetic Stimulation, or Deep TMS, is a non-invasive augmentation procedure for individuals who don't adequately respond to first line of treatment such as therapy or medication, and uses magnetic pulses to stimulate deeper regions of the brain. Unlike standard TMS, which targets surface level activity, Deep TMS reaches deeper, engaging the areas most involved in emotional regulation and behavioral control. The session is simple. You remain seated and awake throughout the session. A cushioned coil is placed over your head. You may feel light tapping and hear soft clicking sounds, but there's no sedation, no downtime, and no cognitive disruption. Each session lasts between 10 to 20 minutes, depending on the case, and can extend up to 30 minutes. Most treatment plans include 20 to 30 sessions over 4 to 6 weeks, depending on your response. At Amaha Mental Health Hospital, Deep TMS is delivered by clinicians who are specially trained in neuromodulation and have extensive experience in safely and effectively administering each session within a structured clinical setting. Every session is protocol-driven, with continuous safety checks, progress monitoring, and full compliance with the Mental Health Care Act 2017. Most people return to their day immediately after the session. Side effects, if any, are mild, typically just scalp discomfort or a slight headache, which usually fades on its own. If you think this might be the right next step, please reach out to your psychiatrist, who will help you determine if this is the right option for you.